Here's what it looks like. That was the standard, right? We know this is cervical because it looks like a house with a bifid process, chimney stack, and it also has bushes on the side. These transverse foramen, let's just point this out. There are holes in the side for something. Let's just name that something. We know this was the spinal cord. This is going to be an artery. What do you call this artery? Hint, hint. What do you call this artery? I would call it vertebral artery. So this is the passageway for the vertebral artery. And C1, let's see what C1 looks like. What did I say C1 looked like? It had to have a platform. So if we look at this image, which one has a platform? This guy or this guy? No, this one has a platform. And I said C2 had a process that we could spin around, right? So this was called the dens. So which one has the dens? C2 has the dens. So C1, what's missing? Didn't we say that this is the standard? So I have vertebral body, I have these sharp pointy processes in the back, I have all of these structures that look like a house. Do you see a house? No, I don't. So C1 is missing a body. Obviously, it can't have the body. It's missing the spinous process in the backside. And it has these little platforms that allow for the knuckles of the skull to sit on top. What about C2? Well, C2 is also missing the body. In its place, it has the dens, which you can access around, right? And it still has the bifid process, so I can tell that this is cervical because it has the two pointees on the end of the spinous process. So one more time, test question. If I ask you C1, what is C1 also known as? C1 is atlas. What is C2 also known as? C2 is axis. And which one has a den? C1 or C2? C2 has a dens. Which one is missing a body and missing the spinous process? That's C1. Okay, so not too bad, right? C7 is prominent. If you try and feel in the back here for a prominent ridge, the one that you touch and it's easy to find is usually C7. Ligamentum nuchae, it's not something we have a lot of development with, but if you look at a cat, it acts like a bridge. So it's found in the back here, and what it is it's a ligament that kind of acts like a bridge. So because the cat's head is always downward, it has to have, in addition to your muscles holding, or their muscles holding their neck up like we do, they have to have, or it's nice to have a ligament that acts like a bridge to help support this region of the neck. Thoracic vertebrae, we already know what this looks like, but let's take a look at some of the parts of it. So we said it was heart-shaped, but it has to hold stuff. What is all of this? It's the rib cage. So the ribs will branch off of here. They connect at this point, and then they connect again here so that they can pivot and swing, and there's double support. Again, here's one attachment, and here's the second attachment for the rib. So later on when we talk about the rib, then you'll have an understanding of why one side has 2 points or 2 bumps and the other side doesn't. Lumbar vertebrae, that one's pretty easy. We said sumo man. Sometimes it has boobies or mammillary bodies that allow for the attachment of muscles. But just remember, sumo man, and this looks like the samurai hat. So sumo man, sometimes there's boobies, and he has a small head. So what did we say for cervical? Let's take a look back at cervical. Large vertebral foramen, tiny little body. As we go down to thoracic, the vertebral foramen gets smaller and the body gets larger. And then we finally get down here, and in comparison, the vertebral foramen is much smaller and the body